Hello, welcome to sonography-radiology training channel. This series of videos is about normal X-ray findings simulate disease. This is the third video in this video series about normal pelvic X-ray findings part 3. We will review 10 cases together. Case 1. In this AP view, in a 4-year-old girl, we can see normal irregularities of the metaphyseal margin of the gross palate in early childhood. Another example of these irregularities in a 4-year-old boy. Case 2. Normal double counter effect of cortex of the superior aspect of the femoral neck in a 4-year-old boy. This is a common appearance in children of this age. Case 3. We can see here the upper femoral notch in a 13-year-old boy. This is probably the same lesion seen in the humeral neck in other metaphyseal sites. The lesion disappears is of no significance. Also note the poor definition of upper margin of the femoral neck, also of normal appearance at this age. Another example of the upper femoral notch and the poor definition of the upper femoral margin in a 12-year-old boy. Here are another examples of other femoral notches. In this AP view, in a 35-year-old woman, we can see probable residua of the upper femoral notches. Case 4. In this AP view of an 11-year-old boy, we can see here normal irregularities in the lucencies in the femoral necks. Another example of the same irregularities and lucencies in the femoral necks in a 16-year-old boy. Case 5. In this AP views, we can see normal lucencies in the necks of the femora named Ward's triangle, formed by the angle of trabeculae in the neck of the femur. Ward's triangle, a radiolucent area between principal compressive, secondary compressive, and primary tensile trabeculae in the neck of femur. It should be differentiated from Babcock triangle. Babcock triangle is a relatively radiolucent triangular area seen in the subcapital region of the femoral neck on an AP view. We can see here Babcock's triangle and Ward's triangle simultaneously. In this region, the trabeculae are loosely arranged and surrounded by more radiodense normal bony trabeculae groups. It may be the initial site of infection in tuberculosis of the joint. Case 6. You can see here bilateral localized trabecular radiolucencies in the femoral neck of a healthy 53-year-old woman. Case 7. This AP views, we can see normal triangular radiolucencies in the femoral necks produced by the heavy trabeculation in the center of the femoral neck and the overlap of the femoral head medially. This appearance may be asymmetric in its presentation, like this image. Similar radiolucencies may be seen in the frog leg projection, like this image. Case 8. We can see trabecular reinforcement of the femoral necks secondary to osteoporosis. This alteration should not be confused with the trabecular changes of the Paget's disease, like this patient. Another example which shows better defined trabeculation in the elderly woman caused by osteoporosis. Case 9. You can see radiolucencies produced by overlap of greater trochanter and the heavy trabeculation in the femoral neck in a 51-year-old man. Case 10. Slight rotation of the right femur produces an apparent lesion in the intertrochanteric region of the right femur. Now, I suggest 2 other of my videos that are close to this video in terms of matter. Thank you for your attention.